Many of the troubled adolescents I work with come into treatment thinking they know more about the chemistry and effects of various substances than I do. Sometimes they're right. It's hard to keep up. Pro-drug websites provide detailed instructions on how much over-the-counter cough medicine is needed to trip, or which brand of decongestant provides the best rush. The Drug Enforcement Agency recently sent out an alert about a new trend among high school students, mixing cough syrup and power drinks to get high. And high school students come seeking prescriptions for Ritalin or Adderall, having already tried samples given or sold to them by classmates. The situation can be even more frustrating for parents. What do our children know or think they know about substance abuse? What are the real risks of tobacco, alcohol, illegal drugs, over-the-counter medications and supplements, and prescription medications? How can we help keep our children out of trouble? How do we know if they're in trouble? Sometimes we feel like we want to keep them in their rooms for their own protection until they turn 18 or 30. Or maybe we don't want to talk to them at all. After all, if we ignore the problem, it may just go away. It's not worth the risk. Government agencies report overall declines in the rates of tobacco, alcohol, and some illicit drug use by school-aged children. Yet use of other substances, like prescription medications and ecstasy, are on the rise. Although there is good news, statistics alone provide little information about actual degree of use, sort of like discussing the average weather conditions across the country. It does not mean much that, on average, the nation is partly sunny and warm when there are tornadoes in your neighborhood tearing homes apart. The National Center on Addiction and Substance Abuse at Columbia University in New York is sounding the alarm that too many parents underestimate or are not aware of the dangers teenagers face, and that inadequate supervision contributes to the drug problem in our country. Parents who are informed and determined to stay involved in their children's lives are more likely to prevent or delay initiation of substance use. As we will see, some risk-taking behavior is normal, even necessary for healthy development. But research shows that delaying the use of drugs and alcohol is associated with better outcomes. Older teenagers have more information, a more solidly developed sense of themselves, and are better equipped to decide what is and is not in their best interest.